So I'm truly, truly grateful to have Mark Cuban with us today. Please join me in welcoming Mark to the stage.
Thank you. Other Claire, thanks. You had me scared, Claire. I was like, I didn't prepare a speech.
No, you're good, you're good. Well, welcome.
Thank you.
So nice to have you here. So we're gonna have a little bit of a chat and go from there.
Perfect. And I need to first thank Brittany for setting all this up, and Cora. They did a great job, so thanks for having me.
Yeah, they've been amazing. So as I was preparing for this, one of the things that was interesting to me, you talk about the fact that at one point in time, you were like most purchasers and had really no clue, right, about what was going on with healthcare, what to do
about it. I
My
had my guy who took care of my companies.
Yeah, the guy.
Yeah, the guy, you know. Oh yeah, everybody else is going up 9%, you're only going up 6%.
Yeah, so that's all good.
Right.
So I want to ask you about 2 pivot points. What made you at some point say, well, wait a minute, I got to figure out what the guy is saying and what it really means? And then how did you go from that point to the idea you had for cost plus drugs? Because we have a lot of people in here who are committed but struggle with getting it on the docket. So
I got a cold email from my co-founder, Dr. Alex Oshmayansky, and he wanted to create a compounding pharmacy because there's still generic injectables that are in short supply. You know, there's pediatric cancer drugs that go on short supply. So I'm like, okay, that's good. But it was right around the time the farmer bro was going to jail. And I was like, how does this dude just jack up the price of Daraprim 7,500% or whatever it was? I mean, that's crazy. And I started looking into it and realized nobody knew what price they paid for anything.
Amazing.
Anything in healthcare, which I thought was insane. So I thought, okay, let's create a website, costplusdrugs.com. But where we're going to be different is when you go to Cost Plus and you put in the name of the medication, if we carry it, we're going to show you our actual cost. Then we're going to show you our actual markup, which is only 15%. And that way, people will know what they're going to pay, but they'll also trust us because they'll realize that a 15% markup is fair. And that's exactly what's happened. We launched January 19th of 2022 with 111 SKUs. Now we're up to 7,200 and have helped millions of people. But to get there, you know, to answer your question, it really comes down to asking questions but demanding responses. Because what happens now is we all know it sucks, right? There's no question about it. That's why we're all here. But we all accept that there's certain things we can't do. And that's the problem. If, you know, in your roles at your companies or your unions, whatever it may be, if you don't know the price that you're paying for healthcare or medications, you're getting ripped off. Period, end of story. And there's a 99.99% chance you are getting ripped off. So what do you do about it? You demand an audit. Now what happens, that's not unusual to demand an audit, but what typically happens, your pharmacy benefit manager in particular will say, well, here's 300 claims and use our company to audit. No. Like if you were to come on Shark Tank and do that, I'd be like, get the hell out of here, you know? Mr. Wonderful wanted to take it behind the barn and shoot it, you know? But yet we accept it. And then you do an audit and you realize you got ripped off. And then you say, you ripped me off, can I have more please? You go back and you do a contract. Why would you do a contract with a PBM or an insurance company that's taking advantage of you? Or that you've seen take advantage of the state or other unions or other employers? Stop doing business with them. That's how we gain control. Now there are 25, 26 truly transparent, not pretend transparent, but truly transparent PBMs. You can go to business.costplusdrugs.com and we list them, and they will work with you and you own all your claims. You see all your prices. You understand what you're going to pay before you pay it. That's the steps that need to be taken. Don't, just because they're big companies and they try to intimidate you, don't accept it.
I like that answer. Don't accept being intimidated. So you're pivoting, you're moving to expanding it to hospitals. I'd say when you started Cost Plus Drugs, you wanted to really revolutionize how we paid for drugs. I would say that impressive list of transparent PBMs is a testament to the fact that you succeeded.
Yep.
So one of the reasons we were pretty tenacious in asking you to speak on our stage was because of your announcement that you were expanding this with Mark Cuban Cost Plus Wellness
yeah.
to hospitals. So can you talk a little bit
Sure.
about that?
So my daughter plays basketball, and she
That's
did play
shocking.
basketball. It's shocking,
Yeah.
right? Who knew? And she fell and broke her hand. Also not shocking. She has my athletic ability. But so for my companies, for our members, we self-insure. And so I had the choice of using my credit card to pay for the x-ray on her hand or running it through insurance. And so I just made a couple calls while we were on our way. And the price that the insurance company had negotiated was far higher than just a walk-in, anybody off the street cash price would pay. So I'm paying for it either way, so I just used my credit card and it cost me far less. And to me, that made no sense. That the biggest insurance companies, like huge, enormous insurance companies, can't negotiate a price that's as good or better than Joe Schmo walking in off the street with a credit card to get an x-ray or whatever it may be, or to get her hand set, all that stuff, to get a cast. And so from there, it was like, okay, why is this happening? And so the insurance companies and even some of the hospitals initially, kind of the PR approach is, well, we need higher prices here because we absorb Medicaid and Medicare, and it's our balance of business. Right? That's bullshit. Right? And so I started talking to hospital CFOs, large systems, and CEOs, and I just asked them about how the system of payments works. Because healthcare at its base is a really, really, really simple, easy business. And I mean that with all sincerity. You go to the doctor, you get good, medium, or bad news. Mm-hmm. If it's good news, you walk away smiling. If it's medium news, okay, bad news, bad news. But there's only two questions remaining to be answered. What does it cost? And how am I going to pay for it? That's it. But answering those two questions have become so convoluted and so crazy right now that nobody knows what the cost is and nobody knows who's paying for what or how they're going to pay for it. And the cause of that starts with insurance companies. Think about what happens with plans that you guys deal with. You talk to your insurer, or even if it's an ASO, right? And you say, okay, let's put together some plans. And they put together a couple different options. They'll have lower premiums, higher deductibles, higher premiums, lower deductibles. But even the lowest deductibles, those numbers are going up.
Absolutely.
Why? Because they know the higher the deductible the plan, the less likely a member can afford it. And if the member can't afford their deductible, then guess what? The insurance company isn't on the hook, are they? So now all of a sudden, the provider has to deal with the deductible of the now patient. Mm-hmm. So what happens? They have third-party financing, or they become the lender for that care. Well, that's turned hospitals into subprime lenders because a big chunk of that lending that they do to patients to cover the deductible or max out of pocket doesn't get paid. So now they're in the hole because the deductibles aren't getting paid and they're still trying to provide care, and now they're sending out all these bills and that's creating all the medical debt, right? So that's part one. Part two, when they negotiate a deal with an insurance company, let's just say it's something simple like a hip replacement. And somebody goes in, gets their hip replacement, they send the bill to me as the self-insured employer. Well, then they go back to the hospital that did it and say, yeah, we negotiated $25,000, but we're only paying you $20,000. Deal with it. What? Right? But now as a result, all those underpayments, the hospitals have to have administrator after administrator, lawyer after lawyer, which in turn increases prices. So now there's subprime lenders. Now they're having to deal with getting underpaid for their contracted amounts. But wait, there's more. Then they do pre-auth. Now, pre-auth is maybe 10% about denying claims that shouldn't have been offered in the first place. It's 90% delay tactics. Because that delay tactics allows them to keep all the premium money. And when you're talking tens of billions of premiums a year at 4% interest rates, you're talking about real money. But the downside, the second order impact of that is what? Your doctors, instead of dealing with caring for patients, are now dealing with committees with the veterinarian making a decision on a heart transplant. I exaggerate, but you get the point. It's not that much of an exaggeration. And so hospitals now are put in a position where they have to make up those fees. Because it's not just straight, Shark Tank type business. Here's the price, you pay for it, yada, yada. Right? Now it's, okay, we know they're not going to pay the full amount. We know they're going to use these delay tactics so they get access to the capital. So we're going to create facilities fees. We're going to take advantage of 340B. And we're going to find all these games that we're going to play. We're not going to be site neutral. And so they're playing games. So now all of a sudden, because of the plans that were created by the insurance companies, all these second order impacts are impacting how we do business and making it hard. So what I said was, all that mishigas is wrong. It's not the way it's supposed to be. I went to all these hospital CFOs and CEOs, and we said, we want a direct contract. Now, there's nothing new about direct contracting. It's happened forever. So we want a direct contract. We'll pay cash price for things that you've already published as your cash price, and then we'll use a reference-based price for everything else. 120% for this, 80% for that, 150%, and then for things that are like really bad, we'll negotiate it in real time, right? Because someone's in a car crash, you didn't know what to expect, you just have to deal with it in real time. We'll just be fair, knowing that it's non-exclusive direct contract. So in Texas, if it's hospital system 1 and we call them, presumably it's not an emergency room routing, we'll ask for pricing in hospital 2. And if there's a doctor that we already know is dealing with some of our members, we'll go to them and say, okay, here's what we're going to do. No pre-auth. We'll do all the pre-auths. We're not using an ASO to do our pre-auths. It might come to me. It's come to me often. Should we pay for this, yes or no? Well, yeah, the guys, da-da-da-da-da, we'll pay for it. There's no pre-auth as far as the hospital is concerned. Once the person gets to the provider, we're paying the cash rate right there and then. If your billing cycle prefers 30 days, okay, we'll take 30 days. But if you want paid right there and then, that's why we're getting the cash price. No negotiating, no administrators, none of the games that have to be paid. So you get your money right away, and it's at the contracted price. We don't try to underpay you. And they're saying yes. And so we've got 8,400 providers, but wait, there's more again, my new favorite saying, right? What's different about all that? Not a lot, but this is. All those contracts we negotiate, when we negotiate them, we say, we are going to publish those contracts so anybody can use them. We're not going to charge anybody. It's going to be on costpluswellness.com by the end of the year, and you'll be able to take the contracts that we negotiate and use them right out of the box, or use them as a template, or use them as a starting point. And in doing that, we've been doing it 8 months now, the start of the year, and we're saving 10 to 12% most months. Every now and then, if something bad happens, our cost will be higher than we budgeted, but typically we're saving versus what the ASO had negotiated for us, 10 to 12% per month. It's working. And slowly but surely, the providers are like, this is better. Now, on our end, we hired what I call our healthcare CEO, the person who works with our TPA to make sure all the things work together. And if we ask our members before they go to have any care, just check with us first. Even if we have to pay the previous price, if you will, that the ASOs had negotiated with your doctor, we will. Now, the hardest part was because we don't have everywhere covered, we had to do a wraparound, and it cost us $18 per member per month. And we did reinsurance, and it cost us, I set the threshold at $185,000, and it cost us under $200 per member, per family per month. And that's it, right? It's straightforward, but the key is, except for the really gnarly scenarios that happen to people in life, I know what my costs are going to be before they happen. And they're very predictable, and I get to negotiate. If as we grow and the companies grow, send more people, I can continue to negotiate, and I'll publish those contracts. That's the difference. You don't have to presume that your ASO or whoever's doing the negotiating, you have no leverage. You do, particularly in the state of New York, the city of New York.
That's awesome.
Sorry for the long-winded
No,
answer.
that's good. So at the Health Fund, we're also in the midst of direct contracting. And one of the things that surprised me, because essentially one of the things you said was, insurance companies are making money on the float, right?
Yep.
So a lot of the pre-auth and a lot of those are really not really to deny care so much as to delay,
Yes.
right?
Yeah.
It's a stall
And
tactic.
the PBMs do that too, right?
Absolutely.
You know, you think you're getting a deal when they're doing rebates. If you're using rebates, you're getting ripped off. Guaranteed. In the history of audits of PBMs, has anybody ever heard of somebody who got paid too much money in the rebates?
There you
Raise
go.
your hand. I got a lollipop if you have. Nobody. Right?
So one of the things that surprised us, that we hear hospitals say all the time, this adds 12 to 18% to my costs, right?
Which the pre-auth?
The various pre-auth,
Oh, the other
delaying
stuff.
tactics,
Yeah,
the
stuff.
paying less than,
Yeah, the
than
stuff.
you thought, et cetera. That the hassles of a complicated process.
Right.
But I will tell you that as we've talked to hospitals and said, if we took that all off the table, we might be checking it behind the scenes, but we take it all off the table, right? The pre-auth, the review, et cetera. And they start to get very anxious and say, well, maybe it isn't costing me that much.
Well, yeah,
Maybe
because
we don't want to do it.
They start thinking about the people they work with. My revenue cycle manager.
Exactly.
Gone.
My job gone, et cetera,
Gone.
like all of
right.
that.
Yeah, it's self-preservation.
Yeah.
It's not so much what's the right thing to do for patients to reduce cost. But there are hospitals that realize that the insurance company's power is just escalating rapidly. And, and I just tell them when I meet with them, just do this as an experiment. Mark Cuban, he's crazy. We're just doing it because we want to see da-da-da-da-da. And we're publishing our contracts because once you get that transparency of the published contracts, then everybody has a template to work from. And you don't have to listen to the insurance companies who are lying their asses off to you. Or your ASOs. I mean, think about, ASOs, like, they take no risk. None. The majority of healthcare, the insurance company that's involved, takes no risk. How is that even possible? And here's the thing that drives me craziest, and you'll hear me talk more and more and more and more about. So for ACA plans, and there's obviously a lot of conversations on the premiums, for ACA plans, the average deductible for a silver, give or take, depending on the family, is $4,000 to $5,000. And if it's a family, it's $19,200 max out of pocket, right? 40% of Americans have $400 or less.
Yeah.
I don't even know the percentage that couldn't come up with $1,000, let alone $4,000. But here's what drives me crazy. That same person, before they got messed up in an accident, if they wanted a guarantee for a student loan to go to college, done. They want an SBA loan if they qualify, taxpayers will guarantee it. Done. Mortgage, you want your guarantee. Even some cities, you want to go into the city and they'll give you $20,000, $25,000 to help you with their down payment. Done. You break your neck in a car wreck, good luck. How insane is that? And here we are arguing about how much money for these premium subsidies, how many tens of billions of dollars we can send to the insurance companies. Now, I get why Democrats and the conversation is going on, because we are where we are, right? I'm not trying to legislate or litigate that. But there's nobody asking the question of, instead of sending those tens of billions of dollars to the insurance companies that we hate, that we're talking about ripping us off, why don't we use it to loan money or to guarantee the cost?
Create a Fannie Mae for...
Right. Yeah, create a Fannie Mae for deductibles and out-of-pockets. So that everybody gets care. And we already means test Medicaid and Medicare to a certain extent, right? You can means test the repayment so that if it's me, no, Mark, no guarantee for you. But if it's somebody else who's making $50,000 in Manhattan, right, barely getting by, okay, we'll take 2% out of your paycheck until we go X number of years, and then we'll just wipe it off. And that makes people understand what they're paying for and what their costs are. And you can even argue about that. But the point is, a Fannie Mae, a Freddie Mae, right, to help people pay their out-of-pocket. Because who wins when people can't afford their out-of-pocket?
Insurance
The
companies.
insurance companies. They're like, deductible go up, profits go up. And you guys let it happen.
So I would say, though, this is true, but we do also still see hospital prices going up at double the rate of drug prices,
Yep.
insurance premiums, all of those other things. They are going up at double. So we have to couple both of those, right? So I think one of the values of what you're doing, what we're trying to do, is that it addresses both. It starts by direct contracting. It starts to take out that middleman.
Yep.
That middleman who's gotten very, very strong. But it also empowers a very, very strong hospital industry and that contracting
For sure.
process to bring those rates down, because it's not all. The hospitals, it has been perhaps a survival technique, right, to deal with it. But those, we do data all the time. At 32BJ, we're really nerdy.
You guys are great at that, yeah.
Really, really nerdy. And we think we could pay hospitals about 150% of Medicare, and it would cover the uncompensated care. We believe we should help pay for Medicaid shortfalls. Somebody should pay for folks who don't have insurance.
Right, it's costing us one way or the other.
That's
yeah.
all legitimate. That's part of our social contract. But there's this huge gap between, let's say, 200% of Medicare and we're going to hear from the city of New York later today, 900% of Medicare for ER services. Big gap. So we want to put some of
Well,
that.
because part of it is when the hospital system has market power,
Yes.
right? They're like, I'm the big dog. Come to the big dog or not. I don't need you, right? That's today. If you think in terms of 20 years instead of one cycle, right? I'm in the technology industry. IBM used to be the biggest dog. Remember Yahoo? Remember America Online? Who remembers Prodigy? They were all big dogs until they weren't.
Right.
And then there's hospital systems in various cities, same thing, right? The crazy part is the hospital systems don't know their costs.
Absolutely.
They have no idea how they're going to allocate the cost of the piano and the artwork that's in the lobby.
The fancy decanters.
Yeah, the decanters are
The
always
Chanel
important.
number 5 that you get at New York Presbyterian if you have a baby. Seriously.
I was good with Chanel number 4. Yeah, that's the craziness of it, right?
Yeah.
So when I find, like I go talk to a lot of hospital CFO organizations and groups, and I'll always ask, do you know your costs? And every now and then one will raise their hand, and I'll applaud them because they truly do track up, and they do, attributable accounting, cost accounting. But you get to talk to them and hold them. And if you start, it's going to be cheaper for you to hire somebody in a specialty to go work for the hospital that's not the market leader or to work in a clinic that you create than it is just to default to 900% or whatever it is of Medicare.
Which is crazy. We're building around them.
And by the way, doctors would love you. Because you know who's the most underpaid out of all this? Doctors and nurses.
Yes.
Like literally, they'll have to do 10 hip replacements a day. I don't want my doctor thinking, oh shit, 7 more to go. I want my doctors playing golf on Wednesday.
There you go.
Don't you?
I'm going to pause and see. We have a few minutes for Q&A. So I think we've got, I love it when there's a person in the front row who raises their hand. Stacy,
right there. Look at that.
The floor is yours. Awesome.
So you used the term market power. We talked about sprawling bureaucracies. We talked about game theory escalations here. We talked about 900% of Medicare. Let's just say we also know that a lot of the ASOs, the traditional ASOs, take 30% off the top in spread, so even higher. We have 30% more. If, let's just say, direct contracting becomes a strategy that is embraced across the board, and if there's anti-competitive areas, markets with just a few huge conglomerates or one huge conglomerate, what would stop these corporate healthcare conglomerate leaders from just taking 30% more? Like, how do you control that?
You educate CEOs and CFOs of the companies who are getting ripped off. Like, I'm talking about my guy, who is no longer a friend.
He's not your guy anymore.
He's not my guy anymore. If I would have known, he wouldn't have been my guy. All those beers wasted. But it's not the core competency of a CEO or even most CFOs to understand their healthcare benefits. And so it's a matter of educating them. Because when I walk in, this has been the easiest industry I've ever been in to disrupt. The easiest. Because I walk in and I talk to a group of CEOs, CFOs like yourself, and I say, do you understand what you're paying for this medication or that? I don't know. You know, do you realize that your healthcare benefits are your second largest expense item after payroll? Yeah, but I'm getting a rebate. Do you know that your sickest employees and members are paying for that rebate? No. You know, and the point being that the more you educate them and start giving them details, the stupider they feel. And CEOs hate to feel stupid, and they hate to feel ripped off. And so when you start going in and start saying, okay, here's the problem, then they put you to, here's head of HR, here's head of benefits, and then that person is a battle, right? Because they've got their system already set up. They don't want to change anything, and so it takes time. But again, all this chatter about pharmacy benefit managers in particular, right? Nobody likes pharmacy benefit managers. So they're easy to pick on, and you can get people, you can convince CEOs. And to your point, Stacy, the same thing that's happening with direct contracting. You want to know that you have some semblance of predictability with your care. But you can't do that if you don't even have your claims. Or particularly, you probably get your healthcare claims, but you don't have your pharmacy benefit claims. So just once you explain all these things to CEOs, they understand they're getting ripped off, and they want to see their contracts. And here's the hack that I love to do now. So I finally got some copies of some PBM contracts and insurance contracts from random CEOs I dealt with. And I just stuffed them into ChatGPT, one at a time. And I said, tell me what's wrong with this. Mm-hmm. Bam, 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 bam. I was like, oh, fuck, this is great. Right? And so that's what I'm asking CEOs to do. And CEOs, and I'm suggesting to you, just stick your contract into ChatGPT or Perplexity or Gemini and just say, what's right and wrong with this contract? What should I have renegotiated? Based off of all the things you know about PBMs and insurance companies and ASOs, tell me what a better strategy is. It may not always be right, but it's going to give ideas. And your HR person, your CEO, me, we're not always going to be right either. So just use it as a tool, not the end all be all, but have knowing that you can get feedback as the first pass. Because I get, like when I had my guy, yeah, I trust him. I've been doing business with him. I don't want to pay for a lawyer to look at all this. I don't want to put, my HR people are so busy. I think they've got it figured out. My new employee, ChatGPT, and ChatGPT, Perplexity, Gemini, they all hate each other because I don't trust any of them. Because, AI is not smart. You know how you have that person that remembers everything? Your friend, and you just go to them, what did we do that one day when we did this and this and this? And they just remember exactly. That's ChatGPT. That's all the AIs. So they remember everything they've ever read or been taught or trained on. And so you can compare them all and, pick and see and learn and still do the work, but it just accelerates your ability to determine what's right and what's wrong.
I would add, so we, 32BJ, used our own contract when we went out to ASO, and that is also available publicly.
Very smart,
so
yeah.
I think between us, we have
And
a
you'll give us a
PBM
copy of
contract.
that
Absolutely,
yeah.
we have an ASO contract. We have a PBM, you have a PBM, et cetera. So the tools are out there. So that would be, I guess I would wrap up with first thanking you, but saying, I think what we're saying is, to create a market that works, people have to be educated, your CEOs, your CFOs, yourself, to understand that it is your job to know the prices, to know what you're paying and why you're paying it and how you're paying it. And it's our job to change that market dynamic. Now we're changing 18% of the economy, right? A lot of people making a lot of money.
$5 trillion. Well, here's a fun fact for you. The biggest insurance company, I won't name them, has over 2,000 subsidiaries. They, for intercompany transfers between subsidiaries, $161 billion a year. That is 0.3% of GDP. One company just gaming the system continuously.
But we're going to be bigger than that, right?
Yes.
Right?
So I have just one favor to ask. Go back to your PBMs and just say, hey, we want to add cost plus drugs to the network. Watch how fast they say no, because they know we're cheaper. And if you go to costplusdrugs.com or go to business.costplusdrugs.com, you can request our price list, and we'll give you our entire price list so you can just compare apples to apples. And if you don't know the price, use our price list as a reference and ask them, why aren't you this cheap, or why can't you tell me what the price is? Then you'll know why you're going to be switching PBMs. Because, to Claire's point, it's time. There's no positives that come out from these enormous companies that are middlemen that are just gaming the system. To Stacy's point, 30%, to your point, 900%. How is that right in any universe? Why are we accepting that? And you don't have to. I'm not saying it's easy, because you have to do all the work, right? And that work is hard, and it's a grind, and it doesn't happen overnight, but it will happen, I promise you.
Absolutely. Thank you so much.
Thank you, Claire.
Mark.
I really
This
do.
has been delightful.
Thank you.
Yeah, up here.